Emang udah, Bang? Good morning, sir.
Yes, good morning, madam. Good morning.
We will start by 10 to
10 to, fine. I'll be there. Am I audible?
you are audible.
Okay, fine.
A very warm good morning to our resource person, Dr. Amit Alexander, sir, and my dear online and offline participants. Today we have with us Dr. Amit Alexander. Before giving his lecture. I just simply, in a very brief way, I want to introduce Dr. Amit Alexander among our participants and those who are listening to him from all over the India. So Dr. Amit Alexander is currently associated with National Institute of Pharmaceutical Education and Research, NIPER, Guwahati, as an associate professor in the Department of Pharmaceutics, Ministry of Chemical and Fertilizers, Government of India. He has more than 15 years of teaching and research experience, and his research experience are mainly in the development of chitosan-based injectable hydrogen, thermoresponsive hydrogel for breast cancer therapy, photophysiology of Alzheimer's disease, nose to brain drug delivery, in situ gel for nasal delivery of anti-AD drugs. He had expertise in vitro and in vivo pharmacokinetic estimation of nanocarrier system. Sir has vast experience in the field of nano domain, polymer domain, and which are applicable in the medical technology also. And he has practical skills. He has expertise in spectrophotometric analysis, nano carrier systems, in vitro release, and permeation study. He is a design expert in statistical analysis using ANOVA response surface methodology. He had more than 150 numbers of international and national publications. He has authored 2 books, 6 numbers of book chapter with citation index 2839, having H index 28 and an ITEX index of 54. He is a life member of Indian Pharmaceutical Association, and he is a life member of Association of Pharmacy Teachers of India. We are very much thankful to Sir that Sir has agreed to deliver a talk relating polymer with the medical domain. So thank you very much, sir. Now over to you, sir.
Thank you so much, madam, for your wonderful introduction. And it's really very nice to see all the participants available offline as well. And I can see many of the participants are sitting over here. And it's really very nice to have such an experience. So, without taking much time, I will like to share my slides. So, whether my slides are visible?
Yes, sir.
Yeah, okay, fine, thank you. Just I have to close these options. Actually, some options are coming in my screen. It might not be visible to your screen. Okay. Okay, so once again, I'm very much thankful for the organizer of the CPET who has invited me for this wonderful AICT sponsored short-term training program. And particularly, I'm very much interesting to know about the work going on the CPET because it's all related to the formation of or molding of the polymers into different shapes as far as their toughness is concerned and their other mechanical properties are concerned. So as far as this theme is concerned, like plastics product manufacturing and the recycling techniques. So just a minute. So coming into the theme of this short-term training program, so we are also working in parallel and dealing with parallel with the polymer, which is also required in some other proportion or composition to to mold a particular polymer, and its property can be changed in some certain kind of requirement. like in some in terms of some products or something, which is based on basically uh, when we consider the plastics, there are so many kind of polymers which are of low density, high density, and we have seen there are certain properties which influence the molding capability, and if you want certain product, the toughness. So these elastomers and some polymeric chain need to be tuned for the certain requirements. So likewise, when we are talking about the pharmaceuticals, so in the pharmaceuticals, there is a distinct role of polymers, without which we cannot go for the formation of any kind of delivery system. So that is what it is very much required. So I would like to know from the audience whether you are well aware of this pharmaceuticals or not, apart from tablet and capsule, what we are preparing and what the research is going on. Any comment? I hope everybody is knowing tablet and capsule, right?
Yes, sir.
Yes. So apart from this tablet and capsule, since it is very much available in the and it is very much reachable to everybody, so it's a very common form of formulation. But apart from this conventional form, when we are talking about the nanopharmaceuticals, a vast research is going on entire world in the pharmaceuticals to treat various dreadful disorders which need a particular attention and strategies to convert these polymers into a delivery systems which can deliver a particular API. API means active pharmaceutical ingredient, which is responsible to give a certain kind of activity. Like if you are having a fever, one API is there, that is paracetamol. So paracetamol is there as a drug which needed to be transformed into a dosage form, which is commonly you can see within this 2 years we have seen Dolo. Dolo is a brand name, so Dolo 650. So that means 650 mg of paracetamol is there in that particular tablet, so that it can give the therapeutic effect and it can lower down the fever. So that is how these forms are being changed in the pharmaceutical by use of certain excipients or certain polymers, and we can transform it into some another forms. So there is a huge requirement for to understand this control release system. That means those kind of release system which can release such active pharmaceutical ingredients into the controlled fashion. Okay, so initially when we can see controlled means it should be in your control. Okay, because you are very much predetermined that how this drug will be released into the body, because in general a drug whenever it is going inside the body, suppose you take the example of tablet, it will go into the stomach, and from the stomach it will disintegrate and dissolve, and further it will get absorbed from the stomach, and after 1 or 2 hours this entire process will be end up. Now if a patient is in pain, so he need to take at least 4 tablets a day. Why? Because after certain time the concentration in the body will reduce. So by using various kind of polymers we can increase this particular release up to extended period of time, not for 1 hour but from 1 hour to 24 hours. That means a patient need to take only 1 tablet in a day. I hope you have knowing about this SR tablet, like for the pain relief, diclofenac is available. So diclofenac SR tablets are also available, which is the sustained release tablet. So those diclofenac sustained release tablets can release the diclofenac from that tablet over extended period of time. So for that means a patient need to take a one dose only. So this is a part of just a modification. So now we are controlling the release of the system. So how we are controlling the release of the system, and what is the development we have seen from 1950 based on this controlled drug delivery system. So you can see the first generation, that is from 1950 to 1980. The research was firstly focused on the oral delivery and transdermal delivery and drug release mechanism. So these drug release mechanism include the dissolution and diffusion, osmosis, and ion exchange mechanisms. And generally, in these systems, patient need to take two times a day the dose. And for the transdermal delivery, it is another advanced version of this delivery system which can be used for longer period of time, from 1 day to 1 week. Now, after 1980 and up to 2010, another era came where the smart delivery systems has been developed, which can be able to release the zero order release and uh, combination of first order and zero order by using the smart polymers and hydrogel, which are transformed in from one form to another form after getting a stimuli from the environment. And also it can be used to load the peptide and protein for the delivery of biodegradable depot kind of thing. So and at the end also, during this era, there was a huge research which was focused on the nanoparticles. And after 2010, now the third generation is going on, which is based on the modulated delivery systems, which is on and off insulin and glucose sensitive release mechanisms, targeted drug delivery, anti-cancer drugs, long-term delivery systems which can deliver the drug not for hours, not for days, but for months, like 6 to 12 months. Okay, so such kind of delivery systems are being developed, so that there are certain kind of patients which required this release mechanism of the drug in a consistent manner and up to the longer period of time. So we need to predict the pharmacokinetic profile, and also we can tune our in vitro release mechanism. So here you can see what kind of delivery system you can see observe here. Just a minute. Okay. So can you see the pointer? Is it visible?
Yes, sir. Visible, sir.
Okay. So you can see this is a drug delivery system. Okay, this particular thing is a drug delivery system. Now, what is there in the drug delivery system? So it is a composition of, or it can be used to deliver micro molecules, macromolecules, and nanomolecules. Okay, what kind of delivery materials are there? So delivery materials are basically smart materials and different kind of polymers. Okay, we will discuss more about the polymers, and but before going into further discussion, I will give some research example as well, so that you can understand our area, the pharmaceuticals area. So and you can see the macromolecules which are like peptides and protein, which are highly unstable. It can be delivered through such kind of delivery systems apart from the drugs. Okay, so uh, so this is this particular drug release systems is tuned on the basis of the release mechanism, which type of release mechanism we want. So there are certain kind of release mechanism like diffusion, dissolution, ion exchange, and osmosis. Okay, we'll also see this kind of mechanism afterwards. And this particular delivery system can be delivered through different routes available in the body, like ocular is the eye drop we are taking, ophthalmic product, so ocular route is there, nasal route is there, oral route is there, pulmonary route is there. Okay, and transdermal and parenteral routes are also available. Apart from this, the release kinetics from such kind of delivery systems can be used to further validate its mode and duration of action. If there is a certain release, okay, that means if I draw a graph here, suppose a graph is there which is here, I am saying hours. So from 0, 1 hour, 2 hour, 3 hour, and let it be like up to 24 hours. If a sudden increase is there and sudden fall down is there, and this is the concentration, okay, or percentage drug release. So what happened? This concentration will initially increase, and within 1 hour it will get down. Then again patient need to take another drug. Okay, so again this will be there, this type of graph will be there. Then again third dose is required. Okay, so we can use such polymer, some some typing I can see. Is it visible and audible now? Okay. So here in such kind of thing, now we are in a process to develop, and now the research is being done to deliver the drug into this manner, in a steady state manner. Okay, up to extended period of time. You can see up to 24-hour time, this graph. Now you can understand what we are talking about. So these are done by only using the smart polymers and some kind of polymers which can retard the release up to extended period of time, and in such cases no further need for such multiple dosing. So patient no need to remember how many times he has to take the drug. Only once he can take the drug and he can happily go for the his work. Okay, so this is what the research is all about. And here also, if you see, a vast variety of polymers are available to control the release system. Okay, this release system means I am talking about the drug. Okay, so now these polymers are basically divided on the different basis, like it is divided in the basis of the type of polymerization. Okay, the first one you can see. So type of polymerization mean condensation polymer, additional polymer. So what are the different kind of polymers in the condensation polymer? So nylon and bakelite. Okay, second one, additional polymers, polyethylene and polypropylene, PVC and Teflon. Okay, so these are based on the type of polymerization. Another class of polymer divided and which are used in the pharmaceuticals are on the basis of their structure. That means linear polymers. So linear polymers like Teflon, starch, polyethylene, etc. Branched polymer like bakelite, and cross-linked polymers like polyacrylamide, synthetic rubbers, etc. And based on the molecular force, it has been characterized into fibers, elastomers, thermosetting, thermoplastics. Okay, these thermosetting and thermoplastics are basically used for, it is also used for the plastic engineering as well. And there are certain criteria, it's based on its density, its toughness, okay, and other mechanical property which can be tuned by using certain parameters. So in the fibers, we can see polyamide nylon, PVC, polyesters, and elastomers, including silicons and polyacrylic amide, rubber, etc. And thermosetting polymers example are polyurethane, epoxy resins, and duroplast. And thermoplastics include the polyethylene, polystyrene, and polypropylene, etc. So, and based on the organization, these are divided into natural polymers, semi-synthetic polymers, and synthetic polymer. So, these biomedical application not only include the dosage form only, but also the devices as well, which are to be placed in the human body. Okay, we will discuss this also later. So, for such kind of thing also, we need some tough kind of, composites or some polymer. So, based on the organization, it has been divided into natural polymer, semi-synthetic polymer, and synthetic polymer. The examples of natural polymers include protein polysaccharides and natural rubber. Semi-synthetic polymers includes HPMC, CMC, cellulose derivatives, and diacetates. Synthetic polymers is an example is PVP, Eutrogen, and PEG. And based on the solubility, it has been divided into two broad categories. That is the hydrophobic polymers and hydrophilic polymers. So hydrophobic polymers example include HPMC 50 and Eudragite and ethyl cellulose. And the another polymers, just a minute. Okay, fine. So hydrophilic polymers include like sodium CMC, HPMC, and gum, etc. Okay. So okay, so where we are going to apply and whether it is necessary to do such kind of research. So because as we are thinking about the pharmaceuticals, the two kind of delivery system which comes in first in our mind is the tablet and capsule. But apart from there are certain kind of disorders which I lead, and out of certain disorders I have selected few one. for this presentation because there are so many kind of disorders which we cannot cover in such duration of time. So like this one. So Alzheimer disease. So this is a patient suffering from Alzheimer disease. Okay. So I hope now if there are some audience which don't know the Alzheimer disease, so for them I will tell that this is a kind of case wherein when a person is growing older and older, so its thinking capability and remembering capabilities are losing, and at a certain stage these particular patients they will not remember anything. Okay, so this is a very kind of uh, pathetic condition for the patient as well as the relatives as well. Here in this picture you can see a couple, old age couple is there, wherein the problem is like the lady, she forgot everything. She is not knowing who is the man she is living with, who means where she is living and why. Even they are like they even don't know how to eat and all. So sometimes it become very difficult for the patient relatives also, and who is taking care also for them also to make them feel better. And in US particularly we have seen the number of Alzheimer patient is more in India, and the basic reason is the only thing is that this particular, whenever we are taking a medicine for anti-Alzheimer activity, so these medicines cannot be able to reach to the brain because your entire body is having the blood all over the body. Okay, and particularly brain is restricting the entry of exogenous compound or some impurities directly into the brain through blood brain barrier. Okay, this blood brain barrier does not allow the drug to come inside the brain, and since the drug is not going inside the brain, the patient's problem will not be resolved. And in these developed countries, people generally they used to eat only boiled food. They are not adding some spices or because spices have proved have the ability to act as an anti-inflammatory, antioxidant activity they are showing, and certain uh, spices can in a very small fraction can go and sometimes can bypass this blood-brain barrier, and some of the amount can be reach to the brain. But in our Indian population we have seen this Alzheimer patient, though it is there in the country as well, but this is not that much highlighted as in the US we have seen. So because we are consuming a vast variety of spices as well, like curcumin, piperine. Okay, those things we are consuming on daily basis. So uh, we are not in that much dreadful condition as the other developed country are. Now they started consuming pepper. Now they started consuming curcumin. Okay, gingerol, all those things. Now spices, they like now the blend of spices. So this is a very dreadful condition. Now the research is required to deliver the drug, and it should able to cross this region. It should able to cross the blood brain barrier. Okay, so another disorder is the cancer. So cancer patient we have seen where it's very pathetic condition for the patient because he has to or she has to go through a certain painful chemotherapeutic treatment and therapy. So research is going on to kill the cancer cell, because whenever the anti-cancer drug is entering again, the drug anti-cancer drug is entering the blood. So the drug will see two kind of cell, one the cancerous cell and one the normal cell. So generally this drug is dangerous for this cell also. Okay, for healthy cell, this is healthy. So now there is a research required that it should target only cancerous cell, and it should kill the cancer cell but not the healthy cell. Okay, so such kind of research is required so that it should not cause any disorder with the host cell. Okay, apart from this, this is also a major concern with so many people, like osteoarthritis we have seen in the elderly people, because these joint problems are there, and because the fluid inside these knee joints, it dried up, and the erosion of the bone end, which is responsible for causing the pain, and this severity is too much in the old age people. So there are certain joint replacement is required so that we can replace this particular joints as well. So again, then composites will come into the picture along with the metals. Okay. Now another problem is the tooth decay, and to tooth decay we are having some implants, dental implants, so that we can fix this problem. So again, you can see it is a combination of the ceramics, metals. So these are some bio materials. So all these bio materials we are using to get rid of these few disorders which I have shown to you, and not in the all, but in particularly this tooth and this osteoarthritis and tooth decay. This particular metals are used, and in some cancer, therapy, some other biomaterials are used. So in all, for every disorder, treatment, some biomaterials are being used, and I will share few of the research in a very brief manner, so that you can understand what I am trying to say is like where we are going to apply the polymers. Okay, so let's have a look. So you can see the first one. So this particular example I have taken from this source is given, and this is a piece of their research work. I have put in one slide to make you understand. So this is the biomedical application of polycystic kidney diseases, okay, PKD. And here the polymer which is used and responsible is the chitosan. Okay, so this is a natural origin polymer. So this chitosan, with this chitosan, what we are preparing is the chitosan nanoparticle. Okay, so generally this whatever the approved drug, that is, for example, tolvaptan. So this is the approved drug from FDA. Showed many side effects. Okay, like nausea and muscle cramps and other toxicities when taken orally. If you take in the form of tablet, it will cause many kind of problems. So another problem is IV administration is not feasible. IV means intravenous injectables for chronic diseases, and it cannot be used for a longer duration of time. So solution, what is the solution? So solution is like metformin. So metformin demonstrated a benefit in slowing the cyst growth. Okay, this cyst growth can be suppressed by using the metformin for oral delivery chitosan nanoparticle. So nanoparticles, you can see this nanoparticle. Inside this nanoparticle, this drug has to be loaded. And what will it do? So once it will go from the gastrointestinal, it will pass from the stomach. And after that, see, the pH of the stomach is acidic. So again, we cannot see it is swelling. Okay, it is not swellable. So again, after 2 hours, these nanoparticle will move towards the small intestine. So again, we can see some swelling is there. Okay, in pH 2.5. Again, you can see in further pH, like again, it will move to the large intestine. So here you can see in pH 6.5 and 7.4, the nanoparticles are got swelled up. So once it will be swelled up, it will diffuse the drug, and also it will adhere to the intestine wall, and it will release the drug up to extended period of time. So that particular research is required, and when we have seen this into the different microscopic level, the fluorescent microscope, so based on the fluorescence you can see, so it's supposed to release the drug in the intestine. So we can see then after administering into the animal, the certain organs have been isolated and studied for the fluorescence activity. So you can see the drug, both this chitosan nanoparticle, okay, and free rhodamine drug. So this is not available in brain. It is not there. It is not in the lungs. It is not in the heart. It is somewhat, it is there in the liver, very few in the spleen. But yes, in the intestine, a high intensity can be seen, which confirm its presence in the intestine. So this part of research can be done, has been done to deliver the drug into the nano formulations to the particular site for the treatment. Another example is the co-delivery of this particular peptide, that is a plasmid, and the particular gene, that is a plasmid, the ROG G and DS red. So and along with the curcumin. So this has been loaded into the mesoporous silicon nanoparticle for promoting the nutrite growth. Okay, so what the thing we have used here is the ceramic. Okay, so ceramics is used to prepare the MSN, that is the mesoporous silica nanoparticle. So this you can see has successfully, this volume absorbed about, this is the bed surface area. So these nanoparticle systems are so small that we can get a higher surface area here. Okay, this 672 meter square per gram, and pore radius also is 1.9 nanometer. So a large amount of drug can be loaded and can be delivered into the body. And if you can see, it can be able to release the drug from 0 hour up to 48 hours. Okay, so this can be well taken up by the brain as well. It can cross the blood-brain barrier, and it can be used further to get the concentration in the brain as well. Another piece of work is similar with the ceramics only. So we can see the role of ceramics here in the pharmaceuticals in the form of these MSN particles for the treatment of the Alzheimer disease. Since brain is a challenging organ, which restricts the entry of the drug. So you can see a metal chelator, which is the cleoquinol, represented by the CQ, can be loaded into the drug, and with a gatekeeper mechanism, once it will get into the brain, the gatekeeper will be removed and the drug will be further released into the brain. Okay, so another example is for the treatment of the breast cancer. So by using this tri-block copolymer of a chain of PCl, PEG-PCl, that is the polycaprylactone, polyethylene glycol, and polycaprylactone. So this is in 1 block, 2 block, and 3 block. So that's why it is a tri-co-block polymer. So when this tri-co-block polymer's composition can be tuned to get a certain transition of solution into the gel system. So what is the advantage of using this gel system is, so first of all, it will be the self-assembly mechanism. Okay, you can see this PCl, this is the hydrophobic chain, PEG is a hydrophilic chain, and PCl again is a hydrophobic chain. So both the drugs, two kind of drug, that is the paclitaxel represented by PTX and curcumin, both the drugs have been loaded into this formulation, and this is now ready to get directly instilled or inject into the breast. So once it will be injected into the breast, what will happen is the site of tumor, the intratumoral region where the tumor is present. So directly we can inject this particular formulation into the tumor, and from that delivery system, the tumor, within the tumor, this drug will be released, and the tumor cells will be cured thereof. So this is the another set of example, and here also you can see this is for the rheumatoid arthritis therapy. So here the name is the Soluplus. This is the name used by the inventors. So it is a combination of tri-block polymers of polyvinyl caprylactone, okay, and polyvinyl acetate and the polyethylene glycol. So this is a combination of all these tri-co-block polymers, and by this use you can see when this particular tricoblock polymer was loaded with a drug tacrolimus, and at a certain temperature of 25 degrees Celsius, it will be forming the self assembly nanoparticles, and you can see it is in the solution form. At 25 degrees Celsius, this remains in the solution form, and once the temperature is reached to 37 degrees Celsius, okay, so it will get converted into gel. So this particular transition we required, so that at a particular site of action where we want that this drug should be there into gel form. So the benefit of having a gel formulation is that it will retain uh, at the site of action for a longer period of time. Okay, whereas the solution will go in the neighbor tissue and it can be absorbed there. So to prevent that, we are using the gel formulation. But this injectability can only be done when the formulation is at 25 degrees Celsius. The moment it will be injected into the body, it will get 37 degrees Celsius, and at 37 degrees Celsius we have seen it has a property to get converted into the gel form. That means the moment it will be inserted inside the body, it will change into the gel form, and from there we can get the release of the drug over a longer period of time. This is also the intra-articular injection. So generally those patients who are suffering from the osteoarthritis, so for those therapy, this combination of polexomers, okay, again it is a trico-block polymer chain of PEO, PPO, and PEO. So PEO is basically the hydrophilic ends, and PPO is the hydrophobic end. So upon getting the LCST, a proper LCST, that is the lower critical solution temperature, that means when we are preparing this with along with the drug used here is the glucosamine. So you can see it is a very clear solution, okay, which is prepared by using the combination of P407 and P188. It will remain into the solution form at 25 degrees Celsius. The moment it will injected into the knees, this is the knee joint. The moment it is injected to the knee joint, it will convert into the stiff gel. So this will release the drug over a longer period of time because it is now intact into the gel system, and after certain period of time this gel will be biodegradable. So but yes, the release of the glucosamine can be extended over a longer period of time. So this is the graphical abstract. So solution, you can see it is changing into the hydrogel, and because of the swelling and erosion of the polymer, the drug will be released. Okay, so this is the glucosamine, and this is the polypropylene oxide, polyethylene oxide. Okay, so this is the combination of the polymers which is used for the osteoarthritis therapy. Again, for the breast cancer, you can see this is the PS responsive charge switchable. Okay, that's PG polyl lysine polymeric nanoparticle for combination in the breast cancer therapy. So you can see here the formulation is self-assembled and it is having a negative charge. Then again, it is injected into the animal. Then what happen is the moment here the tumor, you can see this particular region is the tumor region. If you see one cell, this cell, you can see here what is going on. So the drug which is going through the blood vessel, it will come through the blood and it will go to the tumor region, and what will happen is, since the charge reversal will be there, this negative will get churned, will get into the positive charge in the presence of pH 6.8, and you can see the membrane, cell membrane, it is a negatively charged cell membrane. What it will engulf this particular um, nanoparticle inside, and once it will get a lower pH of 5, pH 5, so this pH change will break down this bond cleavage and the drug will be released further. So this is the release mechanism. So inside the body the pH is 7.4, so it will not cause anything. The moment it will get the pH of 6.8, the first charge will be changed, and by charge, once the charge will be changed, it will be easily absorbed by the cell, engulfed by the cell, and inside another pH will be in higher lower side, that is the 5.0. In this pH, this pH will trigger the drug delivery system and it will release the drug. So this is the example of this particular piece of work which we have seen in the earlier slides. Okay, so this is the thing. Another example is the prostate cancer. This is also basically very common, and here the polymer used are the polycaprylactone alpha tocopherol polyethylene glycol and succinate, that is PCL TPGF. So this is also the drug used here is the docetaxel, and with this polymeric nanoparticles has been prepared, and it has to be for the in vitro cell line study. It has been studied in the PC3 cell lines so that we can see the uptake mechanism. Yes, here you can see the blue targets. That means whatever the drug you have used is now successfully getting inside the cells of this PC3 cell line. Okay, so this confirm when we will inject this drug, the prostate cancer cells, okay, this prostate cancer cells will definitely take this up, and the moment it will take this up, again the drug will be released and it will kill this cancer cell. Okay, so that is our target. So, and you can see it has been studied in the animals as well. And further, what we are doing, we are inducing the tumor into the particular animal and inducing the tumor, and we are studying by injecting directly into the tumor whether the size is reducing or not. The tumor size should be released. Sorry, should be reduced. So these things we are studying. So to confirm whether the drug is acting properly or not. Okay. Another example is the same one. This was the graphical abstract, and this is the same study we have seen. So for certain biomedical application like acute and chronic pain, this again you can see the set of polymer, which is a blend of PLGA, that is a polylactic co-glycolic acid. So this is a dye block actually, uh, polylactic and co-glycolic acid. So it can be used in different ratio like 20:80, 30:70, 60:40, 50:50. So, and another trico block thermosensitive injectable in hydrogel was used like PLGA, PEG, PLGA. So this polylactic glycolic acid once combined with the hydrophilic group in between, and both the end of the trico block polymers are of PLGA and the middle block is of hydrophilic block, that is a polyethylene glycol. The thermosensitive injectable hydrogel has been prepared. You can see the preparation method. The drug is loaded with this PLGA system in the aqueous solution. Then further it was emulsified. Then this after emulsification, you can see the microspheres has been prepared for this drug, and it has been now loaded into the PLGA, PEG, PLGA system, that is the thermosensitive injectable hydrogels. So now this injectable hydrogel contains the microspheres as well. So once it will be injected, okay, for the pain, suppose here we have taken the example of sciatic pain. So sciatic pain, generally a nerve is there, sciatic nerve. Okay, sciatic nerve, when it is pressed by some overgrowth of the bones inside the body, the patient are having this sciatic nerve. Okay, so for such kind of thing, you can see that there is a instant formation of the gel around the sciatic nerve. Okay, so this sciatic nerve will further get the drug released over the particular site of action. So this is what uh, site specificity is required, which is known as localized effect. Okay, this is known as the localized effect. Okay, now another set of example is for the polyethylene glycol polylactic acid, that is the PEG-PLA nanoparticles, which have been used for the Alzheimer disease. Okay, so here you can see how the formulation has been prepared by using the multi-invert vortex mixture. So all the way from here we are adding the deionized water. Again from this vortex we are creating a vortex. Okay, a spherical a whirlpool need to be created, and during this formulation will be prepared in the form of nano suspension, and further we can see it has been injected in the this particular animal to see whether there is a uh, increase in the uptake of the drug into the brain as well as in the plasma level. So both the brain and the plasma, they have successfully getting the drug because of the formation of this particular drug into the nanoparticles prepared by the PEG and PLA combination. And also you can see the release of the drug can be extended here up to almost 180 minutes. Okay, so uh, another example is like for the Alzheimer disease, chitosan nanoparticle. So this is also a class of polymers. So here what is the thing is like from the nose root also, from the nose root also, if you consume any drug, it will instantly go directly into the brain region. So considering this phenomena, the nasal route has been used for the delivery of a drug to bypass the blood-brain barrier. So if you use the drug through this route, there will not be any blood-brain barrier. It will directly go from the olfactory bulb or trigeminal nerve. It will directly go inside the brain. So there will not be any blood-brain barrier in between. Okay. So here the drug used is the sitagliptin. Okay. So this sitagliptin is used to permeate from the intranasal cavity. Now you can see after the examination of the through the animals, what has been observed is you can see there is a formulation. This is the pure sitagliptin, and this is a sitagliptin converted into nanoparticle. So now you can see the concentration is in the microgram per gram. So brain, you can see if pure sitagliptin only 1.35 was available. Once it has been changed into the nanoparticle, you can see the concentration has been increased to 6.85. That means more amount of drug is now able to reach the brain because it has been converted into the nanoparticles of the chitosan. Okay, so this is what a comparison is all about, and these are the different example I have chosen. So I hope many of the polymers you are also well aware of, right? Which we have seen, ceramics and polymers. Hello.
Yes, sir.
Yes, because that's why I was looking for those kind of polymers which you can also understand, because these polymers, see, these polymers are very having a versatile nature. The moment if you play with their kind of polymeric arrangements and their some environment, external environment, it can transform into certain kind of different products as well. Okay, based on the concentration and based on the polymer length. Okay, or the size. So, and here I will briefly explain you, as we have seen there is the release mechanism, basically the diffusion and the dissolution control systems we have seen which can control the release mechanism. Now after seeing this kind of examples, you can now very well map whatever I am going to explain you. Okay, so as we have seen, there is the degradable kind of control system, and which is governed by the chemical and erosion. So this is the chemical erosion. You can see after getting in contact with certain enzymes, it got degraded and the drug is releasing. Likewise, the physical erosion, the polymer itself will dissolve and the drug will release. Okay, this follows the fixed law of diffusion. So this is the diffusion phenomena. The earlier we have seen the degradation. Now here the polymer matrix will swell and it will not degrade at certain, but after some time it will degrade. But till then it will diffuse the drug. Okay, so this is what this all about. This is a drug having the delivery system having the drug. Upon getting the water, it will get swell and it will diffuse. So this is the phenomena of the diffusion control release system. This is also an pump which is used on the basis of the osmogen. I will show you one video as well. Please let me know whether audio is audible or not. Audio is audible? Video
Yes, sir.
audible? Okay, fine. So now you can see these are the pumps. Okay, so these are the pumps which are having the drug inside this particular chamber, and upon getting the water from the environment, the osmogens, what it will call, it will collapse. So it will squeeze the drug, and through this pipe it can be delivered into certain organ inside the body up to 1 year, 2 year, 3 year, like kind of duration. Okay, and after that, when the dose will be empty, it will again upon surgery it can be taken out and it can be refilled and it can be used. Okay, I will play this video. Just
Z osmotic pumps offer a simple, reliable, and cost-effective solution for continuous and controlled administration of bioactive compounds in unrestrained laboratory animals. These fully implantable pumps provide a convenient method for maintaining constant levels of test agents in plasma and tissue over prolonged periods of time. The proven reliability of ALZET osmotic pumps in research spans more than 30 years and is well documented in over 11,000 published studies. Continuous delivery via ALZET osmotic pumps ensures reproducible and consistent research results, minimizes side effects and experimental variables, and reduces the risk of stress due to frequent animal handling. Laboratories find ALZET osmotic pumps easy and economical to use, saving labor and time. Miniature ALZET infusion pumps are the only implantable pumps small enough for implantation in mice and young rats. They are used in multiple research applications requiring controlled delivery of test agents, including peptides with short half-lives. ALZET osmotic pumps have no batteries, no electronics, and no moving parts that can fail. The pumps are self-powered through the reliable process of osmotic displacement. Here's how it works. ALZET osmotic pumps consist of 3 concentric layers: the inner drug reservoir, the osmotic layer, and the outer rate-controlling semi-permeable membrane. The reservoir within the core of the pump is filled with the test solution to be delivered. When the pump is implanted, water is absorbed through the outer membrane. The water entering the pump expands the osmotic layer, compressing the flexible impermeable reservoir. This enables the test solution to be released through the exit port at a controlled, predetermined rate. ALZET offers researchers a wide range of pump models in 3 sizes, various release rates, and durations of up to 6 weeks. ALZET pumps are designed for subcutaneous or intraperitoneal implantation. Attachment to a catheter enables direct administration to various target organs or tissues, including blood vessels via ALZET jugular and femoral catheters, the spinal cord via ALZET interthecal catheters, or into the cerebral ventricles and brain parenchyma using ALZET brain infusion kits. In 1977, ALZET pumps pioneered the concept of controlled bioactive compound delivery in the research laboratory. Today, the ALZET osmotic pump has emerged as a proven and valued research tool, enabling revolutionary discovery.
Okay, so just a minute. Okay, so this now it become very easy for you to understand this device. Okay, so this is another application which we have seen, and these are the different classes of the polymers which is there, which we are using, like we have seen in the natural polymers, synthetic polymers, and other branched polymers. Okay, so natural polymers you all are aware, and synthetic polymers include polylactic acid, polyhydroxybutyrate, and polycaprylactone we have seen also, polylactic acid, polyamides, and these are the certain groups which are used and can be combined in dry block and di block copolymers as well. So apart from this, this is a particular pharmaceutical polymers which are used on the basis of the biodegradability and its non-biodegradability. It has been divided into natural and synthetic, semi-synthetic. The biodegradable one, the non-biodegradable one is divided into synthetic and semi-synthetic as well. You can see the example. And this particular natural polymers are from different sources, like as from animal source, plant source, microbial source, and marine source. So these polymers diffuses the drug. Actually, I will show you the video how
the drug is dispersed
which mechanism it is following. Okay,
homogeneously throughout the polymer matrix tablet. Drug release from tablets with carbopol polymers or Novion polycarbophils is controlled by drug diffusion through the gel layer that the polymers form in contact with aqueous medium. When the carbopol-containing tablets are placed in contact with dissolution medium, the following occurs. The drug in the outside layer of the tablet exposed to the bathing solution is dissolved and then diffuses out of the matrix. The polymer swells fast to form a hydrated matrix layer, hydrogel. Due to the cross-linked nature of the polymers, the hydrogel is not single entangled chains of polymers, as is the case with linear polymers, but discrete microgels made up of many polymer particles in which the drug is dispersed. Carbopol polymers and Novion polycarbophils do not dissolve in aqueous medium. Rather, they swell. In contrast, linear controlled release polymers such as hydroxypropyl methyl cellulose and hydroxypropyl cellulose are water-soluble because they are not chemically cross-linked. The hydrated matrix layer controls water penetration into the non-hydrated core and diffusion of the drug through the hydrated matrix. Unlike linear polymers, Carbopol polymers and Novion polycarbophils do not dissolve during the release process.
Okay. So this is another example. In certain cases where not only the human being, but we are also preparing the drug release delivery system for the animals as well. Suppose a lion is injured badly. Okay, so a lion needs a treatment as well as the medicines also. But you cannot give that dangerous animal multiple doses. So for such cases, certain devices or certain therapy is required, wherein you can place the device into the animal and it can release the drug up to the extended period of time. So again, such example is like transdermal drug delivery systems, which I will show you into the form of patches. Okay, just a minute. You can put this patch over the body and it will release the drug up to extended period of time.
Transdermal therapeutic systems are an established dosage form that achieve drug delivery through the skin. This enables innovative drug products with specific pharmacological advantages. The thin patches have a multi-layer structure and are optimized for each active pharmaceutical ingredient. Basically, transdermal patches consist of a protective layer, an adhesive layer, and a backing film. This adhesive layer secures fixation to the skin and contains the dissolved or dispersed active pharmaceutical ingredient, protects it, and controls its release. If required for the patch design, a polymer matrix, a highly efficient microreservoir, or an additional rate-controlling membrane can be used. To start the medication, the patch is applied to the skin. After an activation phase, the active ingredient penetrates into and through the skin at a defined release rate and is absorbed by the blood vessels near the skin. Via the bloodstream, the active ingredient finally reaches its site of action in the body without being subject to the first pass effect. More and more pharmaceutical active ingredients can be administered by this route. Transdermal patches can be worn for at least 1 day and up to 7 days to ensure a continuous and optimal dosage of the active ingredient. LTS delivers innovations and value relevant.
So now you can see how we are using the polymers, because such kind of the last one which you have seen, the transdermal patches, the advantage is that if a patient is showing some kind of adverse reaction, so what the thing is, now you can remove the patch, so that adverse reaction can be solved out. But in case of tablet, if the patient has ingested one tablet and some adverse reaction is seen in the body, now we have to wait unless this tablet has been removed from the body. So that is the advantage of having such kind of delivery systems, and these are the transdermal drug delivery system which can release the drug up to extended period of time. Okay, so these are certain examples, and which can be used, uh, which can be seen into the different kind of application, like collagen is basically used in, you can see, various kind of ocular products. So collagen is basically responsible to deliver the drug for such kind of sensitive or a pattern where you want that this particular collagen can retain the drug and up to some extent of time. Okay, apart from this, albumin is also a polymer which is used for the preparation of different kind of nano conjugates, complexes, and nanoparticles. And gelatin, another example. Gelatin, you have seen the capsules. Capsules are basically in general made up of gelatins. Apart from that, it is also used for the preparation of nanoparticles. These are the some example for the alginates. It has been used for the preparation of matrix tablet, floating tablet, microspheres. Apart from tablet capsule, you can see how many kind of different dosage forms are also available. Ocular gel as well. Cyclodextrin, this polymer, particular cyclodextrin can be used to increase the solubility of a compound, because it is having a cavity. Inside the cavity, the hydrophobic compound has been placed, and outside the cavity, hydrophilic end is there. So it is increasing the solubility of the hydrophobic compound. So it can be used for the oral delivery, rectal delivery, nasal, transdermal, ocular, and control and targeted drug delivery, as well as the peptide delivery. Chitosan is also, we have seen the various examples before. So you can see it can, what kind of drug it can be used: insulin, gene, protein, metronidazole, and such classes of drugs can be used in the form of hydrogels, matrix tablet, complexes, and all. So hyaluronic acid is also used for the ocular therapy, films and microspheres, ocular formulations, nasal delivery, parenteral solutions, etc. Likewise, cellulose also, you can see various examples are there, like biodesive and microdesive film coating and trick coating, and diffusible matrices, etc. Polylactic acid, you can see a vast variety of polylactic acid has been used by the food industry and medical industries as well. Apart from that, certain other industries are there which is using the PLA in very versatile way. So apart from this, caprolactone is also used for the preparation of scaffold, fibers, films, hydrogel, micelles, and nanoparticles. Polyvinyl pyrrolidine is also used to mask the tablet and suspension stabilizer we are using, as it is used also as a viability enhancer for the drug release enhancers. And PVA also, we can see these are the different kind of marketed preparations which are available, prepared from the polyvinyl alcohol in the form of tablet implants, transdermal, optical, topicals, and ophthalmics as well. So amberlite, these are the branded polymers, and it has been used for test masking, sustained release of the drug, and it has been also used to increase the disintegration time of the tablet. Ethosols is also used in the pharmaceutical, food, and ceramics, also for preparing the print and ink. And there are certain use of ethosols in the cosmetics as well. Now, these are the different classes of the materials, okay, and particularly we are using for the materials which are biocompatible. So that's why we are terming it as the biomaterials, okay. So based on their crystal structure and bonding and macrostructure, so these are categorized into three basic criteria, that is the metals, ceramics, and the polymers, okay. So material that are bonded via metal bonds are called the metals. So in the metal surface, there are free electrons are available, so which is responsible for the high conductivity, and it also shows the very good malleability also, okay. But in case of ceramics, these are primarily ionic or covalently bond. So these ceramics are excellent to restrict the growth of microbial growth, and since it does not have any surface free electrons, it is a very poor conductor of electricity, and also both thermal and electrically. So again, the polymers. So polymers, they due to their covalent bonding, these polymers are also non-conductive. So if you combine all this material together, it will known as the composites. Okay, but their property should not be changed. Okay, so some example of the natural composites are the wood and bone. So these are the different classes of the materials which has been divided into metals, and based on their property like porosity, density, its origin like natural, and its synthetic manufacturing. So these are the types of materials which can be divided. Also, these biomaterials, a range of materials have been employed to control the release of the drug, like polyurethanes for elasticity. Wherever the elasticity is required, we can use this polymer polyurethanes. Um, Insulability ability, this silicon. So this silicon is a perfect insulating agent. So this can be used wherein you want to have some insulation. And polymethyl methacrylate for the physical strength and transparency, polyvinyl alcohol for hydrophilicity and strength, polyethylene and toughness of the and where you want the lack of solubility, polyvinyl pyrrolidine for suspension capability. Apart from this, there are certain other polymers which are biodegradable within the body, including polylactic acids, polyglycolic acids, polylactic-co-glycolic acids. We have seen the application of these polymers also in our previous example, anhydrides and polyorthoesters. So these biomaterials should be first of all biocompatible with the body, both in the cellular and the systemic level, and these particular, apart from these polymers, these hydrogels are also there, and PLGA was developed as a resorbable sutures. Okay, and ceramics such as calcium phosphate, this is used for the synthetic bone analog. And apart from this, we can see in the titanium alloy also in the form of metals, which is very much biocompatible, and it has been used in the orthopedic implants. Okay, so where we are using this particular in the medical field. Let's see. So this
The
is
knee
total
consists
knee replacement process. Okay, in between I will.
of the tibia or shin bone, femur or thigh bone, and patella or kneecap. In knee arthritis, the cartilage on the end of the bones slowly wears away, causing pain and irritation, making daily activities difficult. Arthritis can affect all or just one area of the knee. In this case, the entire knee is affected and a total knee replacement is performed. During the surgery, your doctor uses a series of guides to help remove the damaged bone and prepare the femur, ensuring proper implant size and alignment. Next, your doctor will prepare the tibia using a series of guides to ensure proper implant size and alignment. The final tibia preparation is completed and a trial spacer is used to confirm knee stability. Next, your doctor prepares the patella to accept the implant. A trial implant is placed on the patella and the knee is checked for proper implant size and stability. The trial implants are then removed and the surfaces are prepared for placement of the final implants. Your doctor applies bone cement on the backs of the tibia, femur, and patella implants for final fixation. This completes total knee replacement.
So this is an example of a biomaterial which is in the form of a combination of the ceramics, metal oils, alloys. So apart from this, we can take another example by seeing the dental treatment, dental implants also, which is a combination of both ceramics, which can reduce the this one microbial growth, and as well as to give the strength, proper strength, metals are used. You can see if you add these caps to fill this gap between the teeth, it will cause afterwards some sensation and pain. So this is not at all suitable for longer therapy. So to make it sustainable more and to be used for the longer time, so what alternative way is to get a implant fixed over this particular cavity. Okay, so this is also a procedure I will just skip. So this includes certain consultation, and after that the scanning will be done, such kind of scanning, and after that they will prepare a design and they will fix the implant, and after that the crown will be there. See, you can see the implant, the abutment, and the crowning. So this need to be fixed uh, to fill this gap. Okay, in case of dental implant surgery. So this will go first, and after that it will be screwed up here, and over that the crown will be placed. So this is the dental procedures for the implant surgery. So you can see here, these are the preparations, and here in the side view you can see how this particular drilling will be done into the that particular tissue, And the moment the ceramics will be filled, the healing process will start automatically, and the surrounding nerves and surrounding tissue will get in compatible with this particular ceramic. So that's why this ceramics plays an important role, and it is very much resistant to microbial growth as well. So after that, this crown will be fixed. Okay, so inside what will happen is this tissue will grow, and since it is a biocompatible kind of biomaterial, so it will not cause further microbial growth or any kind of pain something after the surgery, after the post surgery. Okay, so this is what the healing process is all about. So this was another example. So in all, we have covered the entire biomaterials which in the pharmaceuticals we are using, not only to deliver the drug into the form of nano formulation, but also we have seen the application of the polymers in case of some implant surgery, dental surgery, and these particular applications are further divided into certain kind of based on their chemical property, physical property, surface property, mechanical property, biological properties. Their so you can see the different classes of materials which are available, which are biocompatible, are metal, first of all, polymers, and ceramics. So in metals we have seen dental implants, fracture management devices, stents, and orthopedic implants. Okay, if the combination of metals, polymers, and ceramics are pacemakers, which is the synthetic biomaterials. So these are the pacemakers which include all those things. In the polymers, we have seen breast implants and ophthalmologic devices and sutures, skin graft. Ear implants include both polymers and ceramics. So now you can guess why ceramics is used instead of metal in such kind of implants, like ear implants, dental implants, heart valves, and bone graft. Okay, so these are the different classes of biomaterials, and yes, there are certain methods which are available for its characterization to be used further, because we have to study thoroughly the structure of these biomaterials by using these kind of high-end equipments, which is based on the different class characteristic property, like for crystalline property, particle size estimation, structure and chemical analysis, and morphology can be seen by using this kind of various high-end equipment. I hope you are using also like X-ray, photon, electron spectroscopy, energy dispersive X-ray, and vibrational spectroscopy like Raman spectroscopy and Fourier transform, infrared spectroscopy, nuclear magnetic resonance. These all will give you a clear picture of the compatibility of your drug, of your biomaterial, not only with the body but also with the drug, that whether it will be compatible with the particular drug or not, and whether if you are looking for a strength, whether it is a malleable, whether its toughness is up to the mark, so its chemical, its particular physical structure should not be changed. So further, if you are forming a, suppose if you want a complete smooth surface, so for smoothness of the surface you need to check its morphology as well by using the scanning electron microscopy, and its internal arrangement can be seen by the transmission electron microscopy. So such kind of high-end equipments are used to characterize the biomaterials which is used for the proper or for a defined application. Okay, so these are the different various other properties, and these are the references which I have used to make you understand that in what kind of work we are doing in the pharmaceuticals with respect to the use of different classes of polymers and biomaterials. Okay, so thank you so much for patiently listening to me.
Thank you very much, sir. The session is now open for interaction. If any participants want to interact with sir, you can. Online participants can raise their hand. We will.
Yes, please. Dr. Anupama.
Yes, sir. Very good morning, Dr. Amit. Your lecture was very wonderful and very informative, very knowledgeable.
Thank you so much.
Sir, my question is that during implantation of our any part of the body is possible of any bacterial infection. So how it can be prevented?
So actually, yes, it is a very valid question because bacteria is a class of microorganism which is very much required to be taken care of because these procedures while handling with the implants, not only these kind of microorganisms are responsible, but also how your body act with that particular implant, whether it is taking up this or not, because your immune system is also there. So there is a particular syndrome also you can check in the internet also, GBS system. So in some patients we have seen some GBS will be very much prone. So your immunity will act against your body. Okay, so that should not be there. And for microbial growth, there are plenty of precautions being taken care to prevent this growth, and there are certain procedures also before placing the implants. So those things can be uh, well monitored or maintained by having this operation in certain controlled atmosphere only, where if that particular facility is not there, then yes, there might be a chances of this bacterial growth, because the selection of sometimes what happen is some kind of implants are coming with some inferior rates also. So what is the purpose, what is the cause of having low grade low prices of such implants? That means they are compromising with the property of the metals. If they are compromising, if they are not adding that much quality of metals, and they are compromising with the class of material to be used, then obviously this particular thing can be observed, this bacterial. This only depend upon the procedures, how the doctors are taking to place the implants over the during the surgery. Okay, that precaution should always be taken care.
Okay, sir. Thank you. My other question is related to injectable hydrogel.
Yes.
Sir, is injectable hydrogel safe for skin treatment too?
See, injectable, if we are talking about the skin treatment, so skin treatment is a superficial local application. That means no need to inject it. Okay. Injectable hydrogel means something we want to inject, and upon injection, we want to get it converted into gel. Okay. So before, during the injection, if you just take an example, injection means you need to drag the solution inside the injection, first of all. So if it is in a gel form, initially, it will not be there in the injection. This is known as the syringeability. So for the syringeability, we want the solution into the solution form. And injectability also, we want the solution into the solution form only. But the moment it will get inside the body after injection, it should transform into hydrogel. Yes. So second part, your question is, injectable hydrogel cannot be used for the skin application, but instead we can use the hydrogel. Okay, we can prepare the hydrogel and we can
We
apply
can
over. Yeah,
we
instead
can
of
use directly hydrogel. We can use directly hydrogel in our skin,
exact.
or we can inject.
No, if skin means, see, if some disorder is there in the skin, over the skin, then you no need to inject the particular drug inside the skin, because you want to get it treated uh, from the outer side. If there is a
Yes.
disorder, if it is a dermatological problem, if it is not at all
Yes.
a dermatological problem, and internal therapy is required, like in case of psoriasis. So in case of psoriasis, we are giving corticosteroids. Okay, so corticosteroids should not be there inside the body. It should be applied over the body, and
Okay.
it should retain over the skin only. Then only it will be useful. Okay, otherwise this corticosteroid will be harmful to the host cell as well. Okay, inside the body. So that we don't want. So we want to have a strategy like gelling therapy, so that it can be placed over the skin and it can give a occlusive dressing as well. So in that cases we can use this hydrogel apart
Okay
from
sir,
injection.
लेकिन my question is also that कई बार स्किन इस जो इन्फेक्शन होता है आउटर सरफेस पे होता है और जेल वगैरह लगाया ठीक हो गया, लेकिन जब कई बार नहीं होता तो मेरे ख्याल से ऐसा भी हो सकता है कि वी कैन डॉक्टर एडवाइज टू इंजेक्टेबल हाइड्रोजेल therapy for the skin treatment.
I don't think that that will work actually, because like fluconazole. So fluconazole internally for antifungal infection, I'm telling you. So fluconazole is used to get an antifungal effect inside the body, but for the topical application, you need to apply some other molecules uh, like luliconazole. Okay, these zole groups are there which need to be applied from the outer side. You cannot take luliconazole in the form of tablet. It has to be applied from the outer side. Ketoconazole
Okay.
has to be applied outside the body. You will not see its tablet is available. Luliconazole, you will not see its tablet is available. Okay, yes. This one, fluconazole. So fluconazole tablets can be available. So those things, like serratiopeptidase, I'm telling you, serratiopeptidase is an enzyme which need to be taken orally. In case of wound healing, if you are having injury in the wound in the skin, that means you need to take some antibiotic as well as some enzyme also, so that it can be healed up. So from outside the skin, you can apply betadine cream. Okay,
Yes, yes.
so that healing process can start from outer side. A local effect can be done, a dressing can be done, but to get it healed from inside, you need to give some extra boost of enzymes. So in case of that, you are adding serratiopeptidase. So the patient is advised to take the serratiopeptidase tablet, so it will act from inside, and outside from the skin, this betadine solution will work. So this is how this dosage form can be given.
Yes, thank you so much. Thank you so much.
Thank you. Thank you.
Hello and good afternoon, sir.
Yes, good afternoon.
So my question is regarding those medicine patches that you showed in your presentation, sir.
Yes.
So I have two questions, sir. My first question is, how do we prevent the other germs and microbes present on our skin that are currently there? And as the discharge method is, I believe, directly through our blood vessels. So how do we stop those other microbes from getting mixed with the medicine and getting released into the blood vessels?
Okay, the patch you are asking about, patch or the devices you are asking about.
So
There
the
are two.
device.
There are two things. One is the patch, which can be like handyplast is then a handyplast. You can apply in the skin and you can go around. And another is a surgery is required to place the implant inside the skin. So
The first one.
first one. So first one, you have also seen wherever you are going for the injection into any dispensary. The first thing the doctor will do is a kind of a spirit. A spirit, it will that cotton he will use and it will dipped into the spirit and it will apply over the skin. Then it will be used for the further injection of your vaccines. Okay, directly it will not give. So the purpose of having this spirit over your skin is to make sure there is no microbial growth, there is no contamination, and it has to be removed through the spirit. Okay, so once this spirit is placed over the skin, you have to wait for few minutes. Why? Because this spirit, after getting the latent heat of the skin, it will evaporate and it will leave the skin in a within fraction of second. The moment it will be free, the surface is now again dried. Now you have to apply the patch. In that manner, you can assure that yes, there is no contamination. There is the skin surface is very much clean. Okay.
Yes, sir. And my second question is, sir, if there are pores present which directly lead to the blood vessels and medicine can be discharged through them, why aren't microbes and other dust particles like these going into a blood stream that are of similar size?
It it is very hard to explain this thing, because if you are asking about the patches and if you are assuring that the surface is now clean, there won't be any chance. If you are see, your patch will be in a sealed envelope. If you are opening the patch and if you are leaving it for some time into the atmosphere, there will be a chance that the microbe will settle. So just after application of after cleaning the surface of the skin, immediately you have to peel out, take the patch and place it over the skin. Okay. So, and our inside body system is also that much efficient to, to fight with this kind of small microbes. Already we are consuming many microbes daily. The moment you are sitting over your place, you are having a great exposure of microbes every second. If you close your door, okay, if you close the door of your room, if you turn off the switch of the lights, okay, and you complete darkness will be there, and you, if you allow a small beam to come inside your room, you can see how many microbes are there, how many dust particles are there, how many suspended particles are there. So we are exposed to those kind of things, but our body immune mechanism is still working continuously 24 by 7. And if the body immune system fails to fight with certain kind of antigen which come inside our body through any cases, then immediately the body will inform the brain. Okay, immediately a message being sent to the brain ki somebody has came inside our body. Then the brain will take an action. Now it will order the body to increase the temperature so that it will not be comfortable for that microbial particle to retain inside the body. That's why you are suffering from fever. The moment you are getting fever, that means it is an indication some external body has came inside your body and your brain has decided to increase the temperature. So fever is an indication some antigen has came which the body is not, allowing it to happily reside inside the body. So that's why we are getting a higher temperature. So that is a pyrogen which is coming from outside the environment. So this is how, because such kind of small microbial content, if you are talking about, it can only be done if you are exposing your delivery system outside into some unhygienic condition, and if you are not cleaning your surfaces, then this microbial contamination can occur. Okay.
Thank you, sir.
Welcome. Any other question?
If there is any questions, then you can write at the chat box also, and we will share, if sir permits, we will share his mobile number and email ID. Basically, email
Please.
ID we can share it, and it is available at the NIPER website also.
Yes.
So, anyone who has more things to know from this topic, they can interact with sir through mail also. Thank you very much, sir. Thank you very much for such an wonderful, informative session focusing on controlled drug delivery, controlled release system, focusing on Alzheimer's disease, kidney disease, chemotherapy, then arthritis therapy, role of polymers in controlled release system, biomaterials, and how the construction mechanism of many different disease treatment fabrication processes. Thank you so much, sir. Thank you so much for spending your valuable time with us and sharing information related to a very state-of-the-art topic. Thank you, sir.
Welcome, madam. And I am also very much thankful for the organizer for giving me an opportunity to share some research topic from pharmaceuticals. And I'm looking forward for some queries from the audience which is sitting there just for the query.
That they have some queries.
I hope these are I think these are students from the institute.
Sir, some are engineering level students, final year student, almost passed BTech.
Okay, okay, no issue.
Few faculty members are also here.
Yeah.
And few students also. And some are already recruited in different industries.
Okay.
Good afternoon, sir.
Good afternoon. Good afternoon.
Sir, my question is, sir, what are the fiber pills, sir? What are
the
fiber pills?
See, pills are the compressed formulations. Okay. So suppose there is a electrospinning method is there. So through electrospinning method, what we are doing, we are injecting a solution over a drum which is having electrostatic energy. So it will convert those sheets into the nanofibers. Fibers are different kind of thing. I am giving you an example of the nanofiber. So these nanofiber sheets can be further compressed into the kind of pellets. Okay, because these pellets or these pills will be of a smaller size and it will be a compressed formulation. So in earlier days, how it can be prepared is by rolling over hand, and after that it is been cutting into the pieces. So this is what the small pills have been developed. So these pills are having some problems, like it will not get disintegrate in the body because because of its formulation process. So that's why some miniature tablets, you have seen miniature tablets, small tablets are there, small size tablets are there. So those tablets are known as the pills. So these particular pills are having a low dose drugs which can be used, and these particular pills can be coated with the entry coated substances so that its release in the stomach can be prevented and its release in the intestine can be further achieved. So these are having a ability to release the drug in the acidic, not in the acidic pH, but in the basic pH, okay, in the intestinal side, so that its bioavailability can be increased.
So my second question is, two types of Strolux and Fibrolux powder. What is the difference between Strolux and Fibrolux powder?
See, these are certain class of formulations because we need to know what kind of particular active pharmaceutical ingredient has been used. So without that, I cannot tell you that what is the purpose actually. Because powder generally based on the rheology, powder formulation are generally prepared to get instant solution. First of all, okay, so that the patient should. What will happen if in the case of tablet, if you see, so tablet when the patient will get ingested, it will go into the stomach. There it has to break down, and after breaking it has to get it transformed into the solution form. So that's why these powders initially, these are the dosage forms which can be prepared outside the body also by taking 2-3 teaspoon and mixing with the solution. So initially what you are doing, you are preparing the solution outside the body so that the time you are saving, so that the moment the patient will ingest this particular powder solution inside the body, immediately action will start. So to get an onset of action in a faster rate, these particular powders are prepared. Okay.
Okay, sir. Thank you, sir.
Thank you. So thank you so much.
Thank you very much for this excellent session. As many of the participants has already written in the chat box also, because this is a topic which every people should know. It doesn't matter from what discipline we have come, since
Correct.
it is essential for every human being to know
Yes.
the mechanisms or techniques related to the medical technology. Thank you so much, sir.
Thank you. Thank you so much. Jai Hind. Okay.
So dear participants, this is the last technical session, theory related to the theory. So after this, we will go for the live demonstration of the processing techniques related to the plastic and allied materials after the tea break. So those who are online participants, they can leave the meeting. And on Monday, we have the test. So at 10 a.m., again, we will join, and the link we will for the online participants, link will be shared by tomorrow to join the Monday test session. Thank you very much.